Hello, everyone. Today we're going to talk about chest pain or suspected myocardial infarction. Some people know this as ACS or acute coronary syndromes. First of all, let's talk about presentation. The classic is crushing chest pain or pressure, shortness of breath. Sometimes some of the classic symptoms are jaw, neck, arm pain. Of course, in ladies, sometimes you'll get these abdominal pain that they may sometimes it feels crampy or something diaphragmatic area. So any of these patients that are suspected, we need to also go ahead and do a 12 lead as quickly as possible. But initially, we want to go ahead and get a good set of vitals. So have your one crew member go ahead and get your 12 lead ready. Get one crew member that's doing some good vital signs, including blood pressure, because that will help us kind of tell us where our treatment may go as far as we can give nitro, we cannot give nitro. But let's look along the chest pain protocols for the state of Alabama. 3.13 is the actual protocol. So treatment, of course, oxygen is needed to maintain pulse oximetry above 95. So people always say, well, every cardiac patient has to get oxygen. Well, if their sats are above 95 initially, they may not need any oxygen initially. Cardiac monitor, of course, 12 lead transmitted if you can. We know there's some trucks that can, some trucks that cannot. We're working on different ways to get that transmission to the right people. But as we know, increasing that transmission of the data also increases the ability for the hospital to have reperfusion areas ready to go. Now, consider an IV if vital signs are abnormal. So, many of us were taught in school, well, you can't give nitro if you don't have an IV, and many paramedics still are leery of that. So I'll leave that up to the judgment of the individual paramedic. But if you have a hypertensive patient that has a extremely high blood pressure, one nitroglycerin may not be enough to cause him to decompensate to the point of be shocky. But again, we'll leave it up to each individual paramedic to make that decision or advanced. If you are using nitroglycerin, the state of Alabama recommends greater than 90 palp blood pressure, and you can obviously do it Q5 minutes up to 3 times total. Aspirin for patients with suspected acute coronary syndrome of 324 milligrams or 81 times 4 if they're chewing hours. Don't forget, if they've already taken it today, up to 324, we don't give any more. If they have any gastrointestinal bleeding, they have an allergy to it, if the patient cannot chew effectively, that may also be something that we may need to think about. But make sure we document why we didn't give it and why that we did not give it. Consider, the state of Alabama says to consider morphine, fentanyl, or ketamine. And you would use your dosing that's in your protocol, but their medications are listed in order of prevalence. So morphine if we have it, fentanyl if we don't, and then if we didn't have fentanyl available, then you could give ketamine as well. At the advanced level, you could use nitrous oxide if in the future we get that. Now, when we go to our exams, or we're giving a quick report to either the ER radio report, which should be shorter, but when you're giving your verbal report at the bedside, onset of pain, quality of pain, radiation severity, time, OPQ-RST, nausea, vomiting, diaphoresis. Don't forget, if they're nauseous, or vomiting, make sure we give them some Zofran, whether it be ODT or IV if we have that. Ask them about risk factors. Are they a smoker? Do they have a family history? Have they had a prior event? Symmetry of pulses. Does the left radial pulse match the right radial pulse? Signs of congestive heart failure. Take a look at their neck veins. Are they flat? Are they engorged? Any peripheral edema, pulmonary edema. Listen to the lungs. When we're doing these kind of key points for ACS treatment modalities, we want to make sure that we're looking for ST elevation. If we see ST elevation, obviously that is an acute injury to the heart. This patient needs to be transported to a reperfusion center. In our area, and most likely, is Huntsville Hospital. Crestwood does do acute caths as well, but most of us are kind of leaning towards Huntsville Hospital just because of ease of access of getting on 565 and heading into Huntsville. 12 leads should be performed on all patients that have chest pain, epigastric discomfort, or any kind of suspected acute coronary syndrome. For example, if you had somebody that was that pale, ghostly white, and that's not their normal, and they're sweaty, but they have no pain, this patient probably should still get a 12 lead. Also, if you're going to a hospital that doesn't do cardiac catheterizations because of patient request or a closest hospital due to a decompensating patient, you may sit with the patient on your stretcher, they may stabilize him, and you may continue to go on to the next hospital. So kind of be ready for that, to kind of an extended patient care if needed. Now don't forget, so we want to Give oxygen if appropriate. If they're below 95%, we want to give it. If aspirin is applicable, we want to give that. And also we want to give some pain management, whether it be morphine, fentanyl, or ketamine if needed. Transmit your EKG if you can. Give a good radio report. And then once on arrival, give a more in-depth verbal report and make sure that you have all documentation ready prior to turning in your report. Thank you so much.